Okay, didn't know.
Are you about to start? Okay.
Oh, just kidding. Alright, we ready?
Right here, I can't say here.
Front bone here is the frontal bone. The coronal suture separates the frontal bone from the parietal bones. There is a suture that separates the two parietal bones, and that would be the sagittal suture. If we flip, the back of the skull as well as all underneath is the occipital bone. We do have a suture that runs up, over, and down, and it separates the occipital bone from the parietals, and that would be the lambdoidal suture. Turn them sideways. We have a suture that runs up, over, and down. That is the squamosal suture. Separates this bone, which is the temporal bone, from the parietal bones. If we're looking at the temporal bone, there's four things that you have to know in the temporal bone. You have the mastoid process, styloid process, external auditory meatus, and then this is the zygomatic process of the temporal bone. We do have a bone up here, the cheekbone, which is the zygomatic bone. It has a process that comes off called the temporal process of the zygomatic bone, and then together this is called the zygomatic arch. If we go back here again, here's our squamosal suture. There's our temporal bone. Just in front of that is the sphenoid. All right. The sphenoid also makes up the lateral aspect of the eye socket. So I can pinch, and that way I'm holding the sphenoid. There are two bones that make up the medial aspect of the eye socket. All right. The one that is superficial is the lacrimal bone. The one that is deep to that is the ethmoid. All right. If we look up front, this is the nose, which is also the nasal bone. If you look inside, you should be able to see a vertical bone running in there. That's the septum. All right. The septum is, for our purposes, for the test on Thursday. When I point to the septum, I want you to tell me it's the vomer. The ethmoid does make it up as well, but if I'm looking for ethmoid, then I'm going to go deep inside the eye socket. Maybe hard to see, but on the lateral aspect of the nasal bone is two little bumps or prominences called the nasal concha. If we go back to the teeth that hold, the bone that holds the upper teeth, that would be the maxilla or maxilla. We do have the bone that makes up the bottom part of the jaw, right? That is the mandible. There are four things on the mandible that you have to know. You have to know the little holes. They are the mental foramen. If we turn sideways, we have to know the coronoid process, mandibular notch, mandibular condyle. If we're looking on the front of the face, there are two foramen that you have to know as well. Again, remember this is the orbit of the eye, so this is the infraorbital foramen. This is the supraorbital foramen. And then if we flip underneath, we have to know the big hole. The big hole is the magnum foramen. On either side of the magnum foramen, we have a condyle. Since they are part of this bone, they are called the occipital condyles. And then last is, if we look at this, this is the hard palate. Most of it is made up of the maxilla or maxilla. But we do have a bone right back here called the palatine bone. So the hard palate is made up of the maxilla and the palatine bone. And I think that's it. All right.
Thank you.